Welcome back, everybody, to another episode of the Brass Tacks Business Podcast. So thrilled today to have the one and only Courtney Hasseman on the podcast. Courtney, thank you so much for coming on. I really appreciate it.
Thanks, Keith. My pleasure.
Absolutely. So for all our listeners, today's podcast, we are joined by Courtney Hasseman. She is a nurse practitioner and certified midwife specializing in integrative gynecological care. Based in historic Leesburg, Courtney helps women navigate hormonal and menstrual health with a blend of clinical expertise and a holistic approach. From menstrual disorders and fertility support to thyroid care and hormone replacement therapy, her work goes beyond routine gynecological care to truly support women at every age. Whether in person or virtually, Courtney and her team are helping women take charge of their health in a thoughtful and personalized way. So, welcome, Courtney.
Thanks, Keith.
And I'm so happy you're on. I'd like to tell everybody a little bit about how Courtney and I met, because it was a long time ago, and
yes,
you had just popped into the office that I was working at as an associate, and you were opening up like right across the street, I believe. Yep. And you were just being a good business owner, going out, reaching out, giving out your cards. And then I think not much less than 6 months later, I was going out and opening my practice. So I feel like we opened around the same time.
Yes, we did.
And ever since then, I've been reaching out to you for help all the time with patients.
Yes.
So
yes.
I'm so glad to have you on.
Likewise. Yes. It's good to have other business friends in Leesburg. So I always appreciate talking through ideas with you.
Wonderful. Well, Courtney, first, I'd love to just kind of have our listeners get to know a little bit more about you and how you got into, women's health and hormone therapy and all the amazing things that you do at your practice.
Yes. So I have been a midwife for, I guess, about 15 years now. I didn't know when I was younger that I wanted to be a midwife. I didn't know midwives existed. While I was in college, I took a bunch of sociology. I loved sociology and anthropology classes. And I took a class in medical anthropology. And we learned about midwives. And I had never even heard of a midwife before. And I had always been interested in sort of what I'm doing now: nutrition, complementary medicine, alternative medicine, things like that. And I just thought, oh my gosh, what a wonderful career. So that was kind of my first introduction. I ended up, after college, pursuing naturopathic medicine. I actually moved to Seattle for a year, and I did a first-year program at Bastyr University for naturopathic medicine, which I loved. There, though, I realized that they also had sort of an adjunct program in midwifery, and I thought, I really think I want to go there. I want to do women's health, and I loved the philosophy of midwifery care, not just labor and birth, but how we approach women's health, how we see our partnership with women in their health care. Just the whole vibe is very different than other fields of medicine. So I kind of switched gears a little bit, and then to be practical, I had to get a nursing degree and then my master's degree in nursing, and then I began working as a midwife. And so for many years I worked here in the community doing routine gynecologic care, and that was great. Totally honed my skills in kind of regular gynecology, office work, seeing all the things, doing all the things. And I did that for a long while. Kind of worked well with my family schedule. So I sort of plugged away at that a long time. And it wasn't until I had been there a while that I thought, I have other skills that I wish I could be using, right? Or, wow, I really wish I had some control over my schedule. Or wouldn't it be nice if I had time in my appointments to do these kinds of things? And so that's when I started getting the itch to maybe do this on my own. I was turning, I think it was about 39. I was getting ready to turn 40. My 40th birthday was a real kick in the pants. Like, you can do this. If you're not going to do this now, when do you think you're going to do this? So yeah, and then I decided to build the practice that I wanted to work at, right? All the things that I had loved for decades, the nutrition component, the caring well for ourselves, the supporting natural fertility, supporting our own health, all kind of the basics. And so I wanted a practice where I wasn't hurried, where I had time, where I had time and space to do the teaching and the counseling. Yeah.
Wonderful.
So then I did it. And like you said, it was right around the time you were opening your business. And so we were little fledglings together.
Yes, we were. Oh man, to go back. So you opened in 2019 or 2018?
2019. It was, my rent started in January 1st of 2019 and my first appointment was in February. So yeah.
That's so funny because my rent started in March and my first appointment was in April. So
Yep.
we were not too
Right
far
there.
apart. Okay. I need to back up because I
Okay.
did not know that. And Jasmine's pregnant. So I did not know this until Jasmine was pregnant. But please explain to people what a midwife is. And maybe
Yes.
even like you mentioned the philosophy, if you could kind of dive into that, like what is the philosophy of midwifery versus
Yeah.
like a doula? Because
Yeah.
I didn't know and I had to
Yes.
ask Jasmine. And
Great.
then I was like, oh,
Basics.
I'm learning.
Oh my
Yes.
gosh, congratulations.
Thank you.
I
Thank
didn't know
you.
this. I'm so thrilled. Okay, so midwives, we are here to support healthy women and normal, healthy pregnancy and birth. The majority of women have healthy pregnancies and labors and births, and you are best served by somebody who is an expert in sort of the primary care of health promotion during your pregnancy and labor and birth. There's a couple different legal differences between midwives, and some of that varies state by state. Certified nurse midwives, like myself, we are registered nurses. We have a master's degree in nursing, and then we pass our board exams. So legally, we are nurse practitioners who specialize in the area of obstetrics and gynecology. We can prescribe medications, we can order ultrasounds, we can do all the bells and whistles during your pregnancy. We can be with women in the hospital, out of the hospital, birth center, really in any location. And we are the experts at normal, healthy labor and birth. So we're the medical provider, and we can care for women throughout the entirety of pregnancy, labor, birth, and postpartum care. Other certifications of midwives, we also have licensed midwives here in Virginia. They have a different path to receive midwifery education. They're not necessarily registered nurses, so they're not nurses. They do not have master's degree in nursing. They can enter from a variety of different backgrounds and fields. They do sort of a one-on-one apprentice style learning. They pass board exams, same thing, sort of masters of normal, healthy labor and birth. They do not have prescription privilege, so they are not able to prescribe medication. They are available for out-of-hospital birth, but not within hospital birth. So their license is a little bit different. Our license is a bit broader because we're nurse practitioners. Of course, lots of women will choose to see a medical doctor, obstetrician for pregnancy and birth as well. The role of the doula is different. The doula is not a medical provider. A doula is there for support, emotional support. So they primarily are with a woman during her labor and birth, though often they'll help beforehand, getting to know the woman, discussing your plans. And so their role during labor is really just one-on-one support, emotional support, providing really the couple what they need to achieve the birth that they're wanting to. So it's not a medical role, but sort of a supportive role, a really important supportive role. We actually know that women who have doulas have better birth outcomes than women who do not. So most women who will birth with midwives will have either an additional midwife or a doula with them to provide that non-medical support that's needed during their labor and birth.
Wonderful. Thank you. Okay.
You're welcome.
And I know I've talked to a lot of providers who it's very similar to, like you said, you felt like you didn't have enough time with the patients. You wanted to focus more on nutrition. Why do you feel like prior to opening your practice currently, why do you feel like it is so restricted versus time? Or, were you allowed to talk about nutrition, prior to opening your own practice?
Yes.
Or were you limited with the certain things you could recommend, where now at your current practice,
Yes.
obviously you have autonomy so you can do whatever you want?
Right. I was never limited on what I could say or what I could do, but the restraints were time, right?
Okay.
In an insurance-based model, you understand this, the name of the game is volume. And so you need to see a certain number of patients per hour. You get a certain time slot for prenatal visits. You get a certain time slot for annual exams or problem visits. And that's that. So, and quite honestly, in general, time with midwives is greater than if you were to see other healthcare providers. So in that regards, I still was able to spend more time than I would have if I was working in other places. But still, when you are seeing somebody, let's say for PCOS, or you diagnose a woman with PCOS, wow, there is so much work that can be done through lifestyle, through nutrition, through supplementation. I mean, you need a relationship with that patient, and you need time to teach and help her through that process, and that requires time and follow-ups, and that's not really available. I think the more you're able to teach and be with and help somebody through the process, the more successful they're going to be. So just giving somebody a printout on, here are the things you need to do, is just not nearly as successful.
Sure.
Yeah.
Okay. So you did that route for how many years were you working as a midwife?
I worked in the office. I was an office midwife for about 8 years. I did that before opening my own practice.
All right. And we also know you're a mom, so you were also raising a family. And
yes.
Did your experience, being a midwife, did that, I'm sure it influenced you, raising your kids?
Yeah, of course.
Or even going through your own labor?
Yes, of course. I mean, I had care with midwives for my own pregnancies, and colleagues of mine got to be with me for my births, and that's really special. Yeah, midwives are interesting people. So I've always enjoyed growing my own vegetables or making my own herbal tinctures. And, of course, my poor children did not have processed sugar in the home and had to take homeopathic medicines and herbals when they were sick. I mean, that's just who I was, and that's who I was as a practitioner, and totally who I was as a mom. And I enjoyed being home with my kids. Really, even from the time I began working, I never wanted to work full time. I've always kind of liked a little balance of some work and time at home as well. When I opened my practice, I had 4 school-age kids at home that I was homeschooling.
Wow.
And I remember kind of before I had the guts to actually open my own practice, I was looking for work, and I wanted, I want to work these hours, but not these hours. And I want to work these days, but not these days. And then eventually it's just like, no one is going to hire me. I have to do this myself. So my family has really influenced sort of how I wanted to design my work, right? To kind of meet my needs and the needs of my family, right? I want to practice where I can walk to work, right? I don't want to commute 30 minutes. I did that. I don't enjoy that. I want to be close, and I want to be able to come home for lunch or walk home for the end of the day. And I want to be able to do weekends or evenings so that I can be at home during school hours, so I could continue to homeschool my kids a while longer.
A true entrepreneur.
Right. I wanted work to be able to kind of meet sort of the whole where it fit in my life. I didn't want to have to change everything about my home life or my family for some job.
Live to work, not work to live.
Yes.
Maybe. Yes. Okay.
Like that.
Well, you've been serving Loudoun County now for, over a decade?
Yeah.
And I love that your office is so close to mine in downtown Leesburg, so it makes referrals much easier. But what do you feel like working in Loudoun County or in downtown historic Leesburg? What do you feel like you enjoy the most about, the community, the patients that you see being in that location? Yeah.
I love having a business here in Leesburg. I love being here in downtown. I love being able to walk to work. I love that, the businesses down here is just a lot of character. I love getting to know the people that I live by. I like being able to see women that I care for at Costco, or if I'm out and about at, I don't know, kids' sports events and things. It's really nice to get to live and work and be in the community where you live, and I have all my kids' schools, which I've homeschooled all of my kids mainly through about middle school, and we've done Loudoun County Public Schools, we've done private schools. I have lots of different kind of appreciation and connection and friendships at all different places in regards to school and sports and things like that for my kids, our church community here in Leesburg, and then getting to know other business owners. It's just a really nice community to be.
Wonderful.
Yeah.
We all love downtown Leesburg. It is the best. So I feel very blessed to not only have, people like you in the community, but you're absolutely right. To be able to live and work here, I feel like it is a blessing.
Yeah.
You've opened your practice. It's 2019. Tell us how that transition was, going from a more kind of maybe regimented, office to now opening up on your own.
Yes.
Obviously, was that scary for you? Were you obviously, like you said, you were looking for freedom and to be able to make your own schedule and still, homeschool your kids and things like that. So tell us a little bit about how that transition was.
Yeah. You don't know how hard it is until you're in the thick of it. I'm sure you felt the same way. If you know everything that you knew before you started, you probably wouldn't start. So you just do it and then you have to figure it out on the way. I mean, huge learning curve. I felt really solid with the things that I knew clinically, but I didn't know anything about building a business. I had 0 social media accounts before I opened my business. Legit. I'd never even had a Facebook account. I had to figure out social media. I had to figure out accounting. I had to figure out marketing, just all these things I never had to think about. And even on the clinical side, working with other colleagues, there was always somebody to answer a question or help me figure something out or talk something through. So then when you're by yourself, I had to do a lot of learning. Everything required research and learning. I did so much continuing education that first year or two because I just felt like, wow, I have so much that I need to learn now. I can't rely on anybody else to help me through those things. So just, I don't know, it was a lot of learning that first year or two.
What do so you mentioned all the little things. It's so funny because when I opened my office too, I had no Facebook, I had no Instagram, and I remember Jasmine being like, "Oh yeah, you're a business owner now. You have to have social media." And I'm like, "No, wait, I don't like to do that stuff, and I don't want to put myself out there."
I know.
I remember the first marketing event I ever had to do, and she came with me, and Jasmine was just like going around the room and just talking to everybody.
Yes,
and
I see it. I can see this.
Oh my gosh, I have no idea what I'm doing right now. And it was funny, I was telling my staff, it's like fast forward, 5 or 6 years, I'm like, now I love marketing. I love going out and doing things, and I was deathly afraid of it in the beginning. So seems like we had very similar starting of our offices. I know that, maybe you can explain kind of how does your office different than a typical like OBGYN, office? Like if a patient's going to come see you, Courtney, what should they expect versus maybe going to just more of a traditional OBGYN office?
Right. Our appointments are not hurried. I allot a 2-hour time slot for all new patient visits. Most are usually about an hour and a half, but I want to have the time there because I don't want us to feel hurried. And sometimes we have a lot of care to catch up on. Even follow-up visits, 60 minutes, 30 minutes. So our appointments are slow, they're unhurried. There's no one else in the waiting room. It's quiet. There's not somebody else, waiting to come in as soon as our appointment is over. I enjoy being able to kind of communicate easily with my patients. I want to hear directly from them if they're having problems or something's not going well with a plan that we had. So it's easy to access me, right? And get help and to message me. There's not, lots of other steps that you have to go through or something like that in order to reach your provider. And care is personalized. We're not cookie cutters. And so meeting each person where they're at, figuring out what are your goals, how do we help you? Everybody has unique situations and lifestyle situations, and figuring out, how can I help this person reach their goals, right? And that's a little bit of counseling, a little bit of therapy, a little bit of coach at the same time as being their healthcare provider too,
Okay. And so what do you feel like, now that you've been doing this for a while, what's the most common misconception your patients have when they come see you or when they see any midwife?
Well, in general, the assumption is that I do pregnancy and birth. And in my practice, we do not provide any prenatal care or labor and birth. And the assumption that that's just what midwives do. Midwives do birth and that's it. On the contrary, we care for women across the lifespan, teens through menopause. We have patients in their 70s and we see lots of teenagers, right? And so Many women choose not to have kids at all. And even if somebody does choose to have children, that's a short pregnancy and labor and birth is a short season. We are spending most of our lives outside of that season. And so caring for all components of, and mainly for teens and women in reproductive years, we focus on just a lot of routine gynecology. So your annual exam and routine cancer screenings and all those things that you need, things that come up along the way. And in addition to that, sort of just supporting menstrual health, how to support your body, just sort of meeting women where they at with what they need. And then we have a lot of patients, of course, perimenopause, menopause care. And that's a different season. That's different challenges. And it's same thing. Important to be able to have time and space to address questions and teach and really help women with their concerns.
And so I know you trained with the Institute for Functional Medicine.
Yes.
As well as the American Academy for Anti-Aging Medicine, which
Yes.
I did not know prior to this. So that's very interesting. So how has kind of that shaped your practice? Or, obviously I know you do a lot of diet, nutrition, supplementation, lifestyle, like you said.
Yep.
Is that training stuff you use every single day?
Yes. I love learning. Big nerd. I read nonfiction. So boring. But I always have a book on something, my family's like, something related to my work at all times, And so I think continuing education is vital for all practitioners, really for all of us in our jobs. And so that's how I continue to grow. So I've loved that. I did a number of conferences with the Institute for Functional Medicine. The American Academy of Anti-Aging Medicine, I did a lot learning about hormone replacement therapy. That's been really vital then. I did a whole year-long program with the Nutritional Therapy Association. I wanted kind of the nitty-gritties on how to one-on-one counsel women on implementing nutrition change and how do you help somebody through that process, which seems easy, but some of those basic habits that people have are the hardest things to change. And so helping some through the basics of sleep and exercise and nutrition and food and all the details around nutrition. So that was fantastic. So I'm always doing something. I have a conference. I just scheduled a conference for the fall through the North American Menopause Society. I'm going to do their conference this fall. So constantly learning, constantly updating what I'm doing. Even now, the information I know now, how I'm managing patients now, it's different than how I did years ago because I'm constantly learning new information, right? Doing the best I can all the time.
For everyone listening, I never thought, I don't know if it's just this summer because it's so hot, I never thought it would be so hard to just get my patients to drink some water. Like, come on, guys, it's July in Virginia, like it's humid, let's drink some more water. But for everyone listening, even the simplest things, like you were saying, Courtney, are the hardest.
Yes.
Even people know, they're like, I'm guilty, I drink a lot of coffee, but I try to just keep the water coming. So there are those little things. So I know that you touched on nutrition, you touched on hormone replacement therapy, which I want to talk about. How, since nutrition does play a big role in your work, how do those nutritional either deficiencies or those habits, or maybe even lifestyle factors, how do those impact, your clients day to day or their menstrual health?
It's everything. It's everything. I think those basics of movement and sleep and hydration and what we're feeding ourselves, that's the basis of health. And so for women who maybe spend years or decades not nourishing themselves with nutritionally dense food, it's going to show itself in many different ways, but a big way is in our reproductive health. Our menstrual period is it's a reflection of our overall health, right? And so when somebody has painful periods, heavy bleeding, irregular periods, no periods, these are all little warning flags that things are going on inside of our body that we need to start paying attention to. And so, it's figuring out what's going on and then how can we support you to help you correct, help your body to correct itself on the path of healing.
And how, other than obviously being very thorough and taking, a good history and exam, what are the main things that you're looking for with a patient who may have symptoms like you're saying,
Yeah.
painful periods? I think that's another question I wanted to bring up, later, what kind of the most common signs and symptoms you see
Yep.
for hormonal health. But
Yep.
how are other ways that you're able to get down to the root cause of the issue?
Yep. Yep. You already mentioned really thorough history is just so important. Tell me everything. Tell me everything from the time you first started your period. Physical exam is important. And then most patients, I'm utilizing lab work. So we're doing lab testing for all kinds of things. So we might be checking hormones, thyroid hormones, estrogen, progesterone, testosterone. We might be checking adrenal hormones, cortisol level. We're going to do a lot of nutrition markers. I want to see where you're at. Do you have low iron? A variety of different vitamins and minerals that are important for reproductive health, thyroid health, right? So we're going to identify if we have any nutritional deficiencies. How we doing on blood sugar? How you doing on insulin? You have insulin resistance? We need to know that. That's important. So usually it's like a really large blood work order that I will warn my patients.
Yeah.
Bring a snack when you're done with that fasting lab work there at Quest because it's a lot. But that gives us a lot of helpful information. And then there's specialty tests sometimes that we'll do as well, kind of fancy saliva tests or urine tests or other things like that. That can be helpful tools if we need to dig a little deeper.
Got it. And so for people, I wanted to touch on hormone replacement therapy because that's such a big topic now in our community. So for those who think that it's just a shot or a pellet or, some sort of, exogenous thing that you take.
Yeah.
How does nutrition affect our hormones, or how can we maybe help our hormones with our nutrition?
Our nutrition definitely sets the rules for kind of regular ovulation, healthy hormone production. So for example, each menstrual cycle, we're making estrogen, we're making progesterone, and that's directly tied in to the things that we're eating. And pretty much that just looks like a lot of whole, real foods, right? Adequate protein, nutritionally dense foods, lots of fresh fruits and vegetables, quality carbohydrates, whether those are whole grains or starchy veggies, lots of good fats, nuts and seeds and seafood and things like that. So in our menstrual years, our reproductive years, our teens and our 20s and 30s, the nutrition is kind of just providing the building blocks for the hormone, making sure that we're making adequate levels of hormone, helping our body clear out and process hormone appropriately so we don't have too high levels of estrogen and things like that. In perimenopause, it's a little bit different. There's some control we have over things. There's some things that we can't control. Our nutrition definitely plays into supporting our hormones, helping our body continue to ovulate as long as we can. The age of menopause is sort of a genetic thing, so there's not a lot we can do to control whether we finish cycling at 45 or 55. Some of that's kind of out of our hands. So it's a little bit of nature and nurture at play there. And whatever we're given in regards to the genetic predisposition towards when we might go through menopause, how we're eating is going to affect how smooth or rough the transition is going to be. It's when we're young and there's sort of this onboarding of hormone and it's like the airplane is taking off and then you're sort of in these reproductive years where this airplane is cruising, and then perimenopause, all these hormones are declining and now we're landing this plane, and it's like how smooth or rough is that descent going to be? And those are the things that lifestyle and nutrition can affect.
That's a great analogy. I feel like my plane is starting to slowly land. So that's a good analogy. It's getting a little turbulent. So you're addressing a lot of hormone health with diet, with nutrition, with supplementation, with lifestyle. What do conventional doctors do? Like if a woman is going to go to a conventional medical doctor, how are they going to treat it? And why is that not effective versus using your diet, your lifestyle, your exercise?
So in our reproductive years, the main tool in the tool belt is the birth control pill. No periods, you can start birth control. Irregular periods, why don't you take the pill? That'll give you a regular cycle. You have PCOS, you can even things out with the birth control pill. Menstrual migraines, why don't you try the birth control? I could do this for like a dozen more things, but you get the point. And that's because there's not the education or the time and the space to do the investigation and figure out how we got into this place and how we get out of it. So it's just hormonal contraception serves a really important purpose for women who need it for contraception. You know what I mean? But the trouble is that most women who use hormonal contraception are not using it for contraception. We're using it as a Band-Aid for all the other things that are wrong with our periods, right? So if that is your best choice for contraception, absolutely have at it. But if you're using the pill just to cover up your heavy periods or your painful periods, then you're not fixing anything. It's not evening out your hormones. It's not doing anything but putting a Band-Aid on. And so if you really want to figure out why you're having these issues and how to go ahead and fix them, then you have to do the work of investigation and nutrition testing and hormone testing and all those lifestyle basics we have to kind of work through to figure out how to support your body. Takes a lot of time to do that. So, I mean, I don't expect gynecologists to have that knowledge. That'd be awesome if they did, but they don't. And so with the resources that they're given and the time frame that they're given, the pharmaceutics are the things that they go for, right? So anyway, typically birth control.
And so essentially the birth control is probably masking their nutritional deficiencies or their poor diet or their lack of exercise, and they think, or everything's fine because it's like, oh yeah, I'm more regular, I'm not it's not as painful, it's not right. Have you seen any long-term issues with patients on birth control?
I mean, we don't have evidence that using the birth control pill long-term is causing issues. It's not increasing your risk of cancer. Actually, birth control pills reduce your risk of ovarian cancer. So there's not risk to doing that, and there are plenty of women who will use that as their form of contraception for 20 years or more. I meet women like that all the time, right? But what you're missing out on when you use the pill or whatever, hormonal contraception for that long of a period of time, ovulation is how we make our own hormones, our own estrogen, our own progesterone. We only make them during ovulation. So if you're not ovulating, you're missing out on all the health benefit of your own hormones. The hormones in hormonal contraception are synthetic and they're not providing you with the same health benefit. That estrogen is building your bone and your muscle, and that progesterone is really kind of calming your brain and providing you with natural GABA. And so you miss those health benefits when you're on something for 10 years or 20 years or whatever.
And you brought up estrogen and progesterone, which I hear a lot with even just my clients that come in that say, my estrogen's really high or my progesterone's really low, but maybe you can elaborate on this. Estrogen is not necessarily bad versus the ratio of estrogen to progesterone.
Correct. They're both really good. They're both really important. And estrogen is, it's the queen bee. It's all the things that give us our femininity come from estrogen. So estrogen is definitely not bad. And if you ask any woman who is 45 or 50 or 55, we miss estrogen when estrogen goes. We're going to complain about estrogen for a long time in our reproductive years, but when estrogen goes away, you're going to complain for a long time about how much you miss it. So none of these hormones are bad. It's just that all hormones, we need enough, but not too much or not too little. And so too much can get us into trouble and too little can get us into trouble. And so really common, for example, high estrogen in women can cause menstrual headaches or migraines, or can cause heavy bleeding, or can cause a more severe PMS, right? And so then we can feel the effects of estrogen being too high. Well, then we have to work on some strategies to help our body. We can't reduce our estrogen. We can't kind of like dial down the amount of estrogen that our ovaries are producing, but we can improve how well our body is moving it out, metabolizing, breaking it apart, and moving it out. Excuse me. That's also the work of nutrition, gut health, liver health, again, a lot of lifestyle related things. Same thing with progesterone. Too little progesterone is usually the situation, and that can get us into trouble. Same thing, low progesterone can cause, well, definitely you'll see that if women are trying to conceive and having a hard time to conceive, low progesterone can get us into trouble there. But it also can cause worsening PMS, mood disorders, PMDD, things like that too. So then again, it's kind of strategies to help your body produce more progesterone, support healthy ovulation and progesterone production. Yeah.
Okay. And so you mentioned, what abnormal periods look like. What are some of the signs and symptoms of that?
Yeah.
And you were kind of mentioning in the younger 20s and 30s, but as we age, and I like the analogy of the plane, as the plane is either plateauing or starting to fall down back to Mother Earth, what are some types of things, or what ways can you kind of help some of your menopausal or perimenopausal clients?
Yeah. It's tricky because there's a huge range of normal, and there's no definitive test that says, oh, you're in perimenopause now. So it's really just a good history, understanding symptoms, and sort of putting in context menstrual health and history, your age, other things that are going on in your body. And then again, sort of some of that we can control, some of that we can't control. So the role of especially things like sleep and movement and nutrition become even more important. Really common, it will happen to everybody, but as estrogen declines, because it's so important to maintaining muscle mass declines. When muscle mass declines, muscle is where you kind of quietly burn calories all day long. Like people who have more muscle just burn more calories. They require more calories to maintain it. So when you begin losing muscle, your metabolism slows. And so the experience of, I haven't changed anything about how I'm eating, I'm not changing anything about what I'm doing or how I'm exercising, and I'm gaining weight. Like that's real, right? Because you are probably losing muscle mass. Your metabolism is slowing down. Sometimes this is accompanied also by kind of stress response and adrenal hormones, and those things can also get us into trouble. So that's kind of a real pivot time, because the strategies that worked for you before in your 20s and 30s won't be the strategies that work for you. The things that you did to maintain weight or lose weight earlier will not be the things that will help you maintain weight or lose weight in your 40s. So it's a little bit of a pivot. And then again, you are sort of dealt with whatever hand you're dealt with in regards to genetics. And there's no way to revive the dying ovary. You know what I mean? It is what it is. She will eventually give out and there will be no hormone production at all. And that's when hormone replacement therapy can be a really helpful tool, because there is no way, and there's no food or herb or supplement that will give you your estrogen back or will give you your progesterone back. Once that ovary is going, that's it. And so the role of hormone replacement therapy is, I think, another important tool to help manage symptoms, and especially when we think about things like combating muscle loss and bone loss and things like that. It's really helpful for both symptom management and also kind of helping us maintain a little bit of longevity in that way, muscle and bone.
I feel like you mentioned cortisol earlier, and I feel like the stress is so high in Loudoun County. How do you help your patients who, have all these different factors going on, their estrogen, their progesterone, maybe their cortisol is through the roof? How can you help people who are or moms, women in general, that are just super stressed?
Right. That's really difficult. That's not easy at all. And I can't change the things in your life that are causing all of that stress. There's so much that's just out of our hands, right? This is where kind of meeting people where they're at is really important. I can't expect somebody to go to fitness classes and go to the gym. Can we go outside for a walk? I can't expect somebody to be able to afford organic food and organic produce, but can we still buy some basics at the store rather than processed food, right? Or I can't expect somebody to cook meals at home. Sometimes we don't have the time for that, right? Can we help you figure out how to find things that are easy or prepared already that are still going to be helpful for your body, right? What can we do to help you sleep? How can we get you to bed earlier, right? What can we do to help promote a little bit more restful sleep for you tonight? So it's different for everybody, right?
Why is sleep so important for our hormones and our health?
Oh my gosh,
I love talking about sleep.
all good things happen when we sleep. This is like, I feel like my teenagers would probably be able to give this lecture because I'm really strict about sleep in my house. I've always been strict with my children and myself. I mean, sleep is when your brain actually processes all the things you learn during the day. For children and just really anybody with a growing brain, all the magic happens when you sleep at night. You learn that information during the day, but you synthesize and that gets processed while you sleep at night, right? The moderation of cortisol, actually, the cortisol drops at night and all of the renourishing your organs happens at night, right? Direct relationship with athletic performance. One of my teens runs year round. He does cross country and track. I'm like, you can't skimp on sleep. There's a direct relationship between how well you perform and the amount of sleep that you get at night. And so all good things happen when you sleep. Now there's seasons, of course, when we have babies and, there's definitely seasons where we can't control that, but we do have a lot of control in those other seasons. And so, yeah, for women to prioritize sleep, we feel more stable mood. We have definitely better stress response. We have better response to everything with all the people around us the next day, right? We know that when you're tired, you're more likely to make bad food choices. You're going to go for the comfort food and the quick food. When you're well rested, you're more likely to say, and let me cut some carrots with my lunch today. You know what I mean? So it's just foundational for everything. I mean, in my house, we're still aiming for my teenagers to get 10 hours of sleep each night, maybe 9. They definitely need more than 8. So I still try to protect to give them 10 hours of sleep with a school schedule. Even adults who are like, oh, I don't need that much sleep. You know what? You do. You need to build in at least 8 hours to your bedtime routine. You should allow yourself that much time. If your eyeballs pop open 30 minutes early or whatever, then that's probably fine. But you should give yourself the space to be sleeping 8 hours or more. Just so we actually know women need more sleep than men. So important for women in so many seasons of our lives to just expand that bedtime, work on that bedtime, figure out how you're going to do all the unwind bedtime routine stuff. Yeah, you got to make it happen. I would rather somebody work and prioritize sleep than work and prioritize exercise. Like, I would rather have somebody sleep in an extra 30 or 60 minutes. Do not cut back on your sleep to get up for early morning exercise if you're tired. Way more important that you sleep.
I was so excited to learn. We took a baby class and I didn't realize that babies get into REM sleep so much faster than adults. And obviously it makes sense because babies are growing, so much more rapidly than we do as adults. But I also remember I did a sleep certification, a couple of years ago. And yeah, 8 hours of sleep is not enough because as an adult, you only go into REM sleep like every 90 minutes and you need at least like 3 to 4 or 4 to 5 cycles of REM sleep a night. And so 7 to 8 hours is not enough. And so your recommendation of like 10 hours or 8 to 9 hours really gives you the chance to get into REM sleep because you don't get into REM right when you fall asleep. It takes a while.
Yeah.
But when I was going to this little baby class, it was, I forget her name, but she was like, oh yeah, babies get into REM sleep much, much faster. And I was like, oh my gosh, that would be so amazing as an adult just to be like, get into REM.
Lay down and make it quality right away.
Exactly. I'd be like, oh my gosh. Do you know any literature or research on like what happens during REM in relation to hormones or women's health during that
great.
period?
No, I don't think so.
Okay.
The book, I don't remember the author, The Why We Sleep. I don't know if you've heard of that book. It was written a long time ago. It's a really great book on why we sleep and why adults need, like you said, for people who say, oh, I'm just fine with 6 hours of sleep. No, but specifically, I guess I have an understanding of how that would help with cortisol and stress response, but I don't know any more details about that, specifically with like sex hormones or things like that. I mean, all the growth hormone too. I'm also just thinking about all those little pituitary hormones,
Mm-hmm. For
you gotta have
sure.
enough sleep. And those are all of our reproductive signaling hormones too. All those
Yeah.
pituitary hormones, yeah.
Okay. So you've now had your practice for 5, 6.
Yeah,
How
6.
has it, what type of lasting impact has it had on you, either professionally or personally, now that you've been in practice on your own for
Yeah.
5, 6 years now?
Yeah. I love my job. It's caused me to grow so much. I think for all the reasons why we had talked about all the stuff you have to learn when you run your own business. So it's really created a lot of space for personal growth for me. And I love being able to provide the care that I do for women. I mean, it's just an incredible privilege to care for women in a really kind of meaningful way, a really intimate way, like I do. I get to know women really well. And there's a lot of everybody, but I think for a lot of women too, you don't have many outlets to share private information. You know what I mean? And sometimes that women's health provider is the person you trust with a lot of personal information. And it's just a real privilege to be able to be the person who helps somebody through that, or a safe place for them to talk, and getting to know somebody and seeing them through years and years. It's really nice. I love being able to care for my women, my patients, just for years and get to know them. I have so many mother-daughter pairs that come to my practice. I have one grandmother-daughter that I see. I mean, it's just such a privilege to be able to provide that care. I love it.
Find it very rewarding when you start to see the generations come through. Like, obviously, I know I'm getting older when I see, like, oh, wow, they were in third grade just like a little bit ago, and now
Yeah.
they're going off to college. And then, you see the daughter and the husband or the mom, and then sometimes they do sometimes bring in the grandmother too. And I feel
Yes.
like it I don't know how it makes you feel, but I feel like when I'm able to give them the time and the attention, and I know that I'm not rushed, and I've done a proper exam, or I've done a proper treatment, or I've done a proper diagnosis, no matter the result, like whether they get better, they get worse, like I always just feel like that was the right way to do it, versus when I was at a higher volume, scenario, I just always just felt like resentful or stressed, or, what do you feel like is most rewarding for you at your practice?
I mean, obviously you feel great when somebody achieves the outcome that they want, right? It's exciting when somebody that you see for infertility care or preconception care gets pregnant. And it's exciting when somebody, who had really irregular periods figures it out and we get them on a regular cycle. I mean, so the successes are helpful, but even outside of the successes, it's just, I think just the relationship and the journey, the being there for somebody who needs you, being a healthcare provider that somebody is comfortable talking to and bringing their concerns with. And yeah, just kind of that relationship, I think, is most rewarding.
For sure. What is one piece of advice you would give to women who want to take the first step in taking control of their own health?
Yeah.
What's one thing you would
I
tell
mean,
them?
you just focus on those basics, just slow, steady improvement, just things we talked about, the sleeping, the drinking water, the going for a walk or moving. With nutrition, the focus is always to focus on the whole food, the real foods. And so anytime you can just opt for the protein, the fruits, the veggies, those things, and reduce the fast food and processed food, any small step that you're taking there is going to benefit you.
Wonderful. Well, I know that you just brought on a new provider to your practice, Courtney. So
Yes.
what are kind of some of your things on the horizon? What's coming? Do you have any events coming up?
Yes.
You obviously have a new provider in your office. So
Yep.
getting her up and running, anything in the near future?
Yep. Yeah, like your practice, it's kind of fun to grow. I think when I started, I definitely didn't envision multiple people in my space, but that happens. So last spring, I brought on Stacy LaRue. Stacy is a nutrition and fitness coach. Like us, she lives and works here in downtown Leesburg. She has a gym, Intuitive Fitness, and she does a lot of one-on-one personal training, mostly with women perimenopause, menopause age. And so I needed more help for nutrition counseling. And again, having somebody else who can walk slowly and help step by step for women implementing change. So that's been great. Stacy has done group classes. We did a whole series of perimenopause group classes, and that was wonderful. I think probably she will restart again in the fall, probably fall, winter, do another perimenopause series. That went over really well. And then this past winter, I brought on another midwife, which is also exciting. There is such need and demand for the kind of care that we provide. And because I'm not in this for volume and I don't want to jam pack my schedule and see patients all day, every day, I've had to limit new patients, right? And so that's always sort of a stinky thing to know that there's women who really want and need your care and you can't provide. So that's been wonderful. So Dominique started with me. She began seeing patients in June, and that's been great. So she's been able to see a lot of the women who were waiting for care, and that's wonderful that we could kind of grow in that way. So yeah, now we have a whole team. And then Lindsay's been with me for, I think, 3 or 4 years, probably almost 4 years. And she does all of our admin, management, everything non-clinical. Lindsay runs the show. So we have a really nice little working team. Yeah.
Wonderful. Wonderful. All right, Courtney. Well, for those listening, I highly recommend, if you are in need of hormone health, menstrual health, please Courtney, what's the best way to get in touch with you or, book an appointment with your office?
Yep. The website is probably the best way. You can contact us there through the website, and Lindsay's great about returning all the emails and calls and answering all the questions that you probably have. Yeah. The website is CourtneyHasseman.com.
Wonderful. Well, thanks so much for being on, Courtney. I really appreciate you.
Keith, thank you. This was a really great conversation. It's good to chat.
I loved it. All right. Well, we will talk soon. And those of you listening, please check out Courtney at CourtneyHasseman.com, and we will see you next time.